Hi, I'm Dr. Michael Lyons with Advanced Chiropractic and Rehab, and I'm here to demonstrate Graston Technique, which is a form of instrument-assisted soft tissue manipulation. It has been around for a while, but it's definitely becoming a lot more popular. A lot of athletes and injuries respond really well to this type of treatment. And it is another type of muscle treatment or myofascial treatment, in which we use these instruments over here, which are just stainless steel tools that have different types of curvature and use to them with bevels on them that are made for breaking up fascial adhesions, which I'm going to demonstrate real quick today. I have a patient over here who we've been treating for ankle and foot problems, mostly plantar fasciitis. We did treat this patient, I believe, last year pretty effectively for this. She had tried several other treatments that were fairly ineffective in resolving her plantar fasciitis, and we were able to utilize Graston Technique. It's relatively pain-free treatment type. It doesn't, like any kind of soft tissue or myofascial work, it can be a little sore, especially when we first start or first begin the treatment. Angel, you've had this done how many times at this point?
Oh, I can't remember.
Okay.
Probably about 20, 30 times.
Has it ever been painful?
No.
Okay, good. And have you ever had any bruising with it?
No.
Yeah. So, it's usually pretty effective. So what we do is we use the tool, and there's several different types of stroke techniques that we learn when we become a GTS provider, which I am certified by Graston, and in which we kind of scan the tissues and we find any adhesions. So when we go over some fascial adhesions here, especially in the calf muscle on this patient, we can definitely feel like some grittiness. So what we'll do when we do that, this is usually the least is we'll get more aggressive tools. That one there was least aggressive, and then we can start some different type of stroking techniques in there. And that usually loosens those up, and as the patient progresses, they'll smooth out, and actually you'll feel quite a difference. This is a very effective treatment for any kind of Achilles tendonitis, which you can see we can usually get some blood flow back to the Achilles tendon, which with this type of treatment, which the Achilles tendon oftentimes is very prone to injuries and problems due to lack of blood flow to it. And this will break down adhesions in tissue and cause it to reform in a nice normal pattern, which will improve mobility also.